There are numerous, we can count over 10 procedures that aren't done anywhere in the Midwest, procedures that we do on a regular basis. You may say that there are places from a spotty standpoint in the Midwest that may do one or the other, but when you start talking about the full spectrum of care and offering all that we have to offer, that's truly unique to this region. We, for instance, if you start talking about having to have surgery for prostate cancer, this is the single institution in the entire area that offers one spot, offers all three approaches: perineal prostatectomy, robotic prostatectomy, retropubic prostatectomy. This is the place where we do major reconstructions of the urethra for people who can't urinate, males who cannot urinate. So we have a very unique perspective, and the nice thing about it is one spot. It's one-stop shopping for the patients, and we offer all of that, as I said, in one department. And I think that that's not only good for our referring docs, but that gives what I would consider to be a true benefit. It's very beneficial for the patients because you can come here and have any problem addressed. I think that our philosophy is to provide state-of-the-art subspecialty care for all of our patients and to do it with the best quality, in fact, above and beyond the best quality in the United States. So we want to deliver that care the best we possibly can for every single patient. So we're treating one patient at a time as if they're our family members. Sometimes it's the people-person skills that make all the difference. You can be the most talented person in the world, have hands that are just blessed, they just know exactly what to do. But if you can't relay that comfort level to your patients, if you can't do the hand-holding, if you can't show them the compassion, and that's what I teach these residents as well, every one of the staff members here do, is if you can't teach them that, if they can't provide that at the bedside, they'll never be the doctor that you really want to go to. You want to go to a doctor who can sit down with you, spend the time, make you realize that their particular disease, I do this 30 times a day, they do it once in a lifetime. And they want to know that this is a special disease process for them, that we care enough about them to spend the time, let them be able to express their concerns, do the hand-holding that we need to do, and make them feel comfortable with the care that we're going to provide. Yeah, I think that not only is the volume important, but the other thing that the patients come in and say, we want someone that's on the cutting edge of what they do. We want someone who does the research also, and every one of us is published extensively in our areas of expertise. You can go on and Google any one of us and find that out. The nice thing about it is not only do you have the people that are doing the cutting-edge research, you've got the people that are doing the cutting-edge procedures, and you have teachers. We're all teaching the next generation of urologists, and I think that's a pretty special group of people that have that passion to do all three. What you and many others should understand is that we have everything to offer at this institution. We feel that we have put together a group of subspecialty trained people in every aspect of urology. We have extra training that are doing the research, that are doing the teaching, that are staying on the cutting edge of their specialties. We do a lot of volume. Remember, we are the only urology program in the state of Kansas. We do a tremendous amount of volume. In fact, if you were to look at national numbers, the average resident getting out, graduating, has done an average of 9 cystectomies, taking the bladder out for bladder cancer. Ours are getting out, all 3 of them in each year, so that's a total of 15 residents if you talk about 5 years of training. Each of them are getting out with about 55 cystectomies. Our volume is tremendous. A huge volume of patients. We do a lot of operating, and we do it very, very well. If you start looking at our databases where we can monitor how well we're doing compared to what's published in the literature and the publishing we do ourselves, it shows that as a standard, we're exceeding the standard in almost all of our cases, and we're providing the best care, we believe, one of the best departmental cares in the country. So I think as a referring doctor, keeping that in mind, knowing that we have all young subspecialty trained people at the peak of their careers in this program, and we cover the entire spectrum of urology. I think that's the very reason to refer to us. We always tell people jokingly, look, we can ski the double diamond black, so you know we can do the greens. when you start talking about snow skiing. So we feel we can do it all, and that's the main reason to get it to us.